If you have lesser thickness there, you cannot grow a plant there. Quick diagnosis and the methodology I'm using: detoxing her liver, helping her bone marrow. From my case record, one of my patients who is under treatment, she has gone through failed IVF, and now I'm preparing her for fertility. I just want to share a quick diagnosis and the methodology I'm using as we are providing treatment around the world. So with the failed IVF, she has a history of delayed cycle, and when you look at the scans which are done on the 12th day of the cycle, we can see a problem with the thickness of the endometrium. Like, you want to sow a seed to grow a plant. If you have lesser thickness there, the soil is not properly thick, you cannot grow a plant there. So likewise, if you're in uterus, you have to have a proper thickness of endometrium as well as the receptiveness. I mean, it should be ready to conceive. So I saw very clearly that she is deficient in that. We're also treating that. So how am I doing that? I'm basically detoxing her liver. I am helping her bone marrow, because surprisingly for you, it's a new information. Bone marrow is the site for the production of your follicles and your semen along with the red blood cell. And this knowledge comes from Ayurveda, the ancient healing wisdom. So I am cleansing and rebuilding. Cleansing liver, cleansing bone marrow, and rebuilding bone marrow and rebuilding endometrium lining to prepare her for the pregnancy. So far we have achieved much regularity in the cycle. The endometrium is being developed properly. Her estradiol has developed properly. I remember progesterone was also fine in the last report. That's how I treat my patients. Always look at the root cause, look at the whole history, and then diagnose the root cause and make a customized treatment which is non-toxic, natural, and yet very effective. And that's what we are doing around the world. If you're struggling, just have a phone call, and that's your first step to begin the holistic healing fertility journey with us.